simple question. You say deliver effective beep. What is the effective beep in the delivery room and how we can monitor it? Can we do like ultrasound will help us? How we know the effective beep? Because it's really like
optimal beep.
I have people now going with start beep of 8 and 9. So, or we use 6 and 7. So what's your suggestion?
I would start with 6. I think starting with 5 is a little bit homeopathic. I would say that really, if you're keeping the seal, an effective transition of heart rate and SpO2 over the first 2 minutes, and I will forward you George Smolger's paper because that's what it shows, that if your heart rate is coming up and achieving the 25th centile, which is usually a heart rate of 100, with saturations that are gradually improving, then actually I think your beep is working in a breathing baby. But if you are persistently bragging product, then your beep is not working. And in those circumstances, if the baby is breathing, you might want to increment your beep and the FiO2. I can't give you a right answer for which. But starting with a beep of 9, the risks there is you might be subjecting that baby to a very high beep where it might not be needed. And the risks then of pneumothorax are there. But the other aspect to it is beep can reduce venous return. You know, a beep of 9 in a baby who's 600 grams right from the start, who's trying to make pulmonary transition by effective ventilation, you might be decreasing venous return. So you might actually make pulmonary venous return, you might compromise it, and then it's persistent fetal circulation, not because you haven't inflated the lung, but because you have a high intrathoracic pressure. Less is more. You know, gentle is what we've been taught. So my advice would be start with 6, increment gradually, look at the heart rate and the saturations, and if they are coming up and the baby is breathing well, then most likely your beam is working. So, use of ultrasound in the delivery suite has a double-edged sword. And then to start off with,
venous return, cardiac output, وهايبوتنشن.
give you that information in 2 minutes, no work is being done. So I can't recommend it at this particular stage. I know that in Mexico they're doing work in babies over 32 weeks and 36 weeks, basically looking at the lung aeration right from birth onwards. And they've demonstrated good recruitment with demonstration airlines. But I'm not aware of any evidence that shows that this is being used in babies.
Just, if you allow me for a small short comment for both of the speakers, thank you for the nice talks.